This is Average Joe PT, and on last episode we talked about sacroiliac pain and the different stretches and techniques that you can do to get rid of your sacroiliac and hip pain. So hopefully you'll watch that after you watch this episode. This episode specifically is going to talk about 4 different positions that you can put yourself in to eliminate your sciatic and low back pain when you're trying to sleep at night. So stay tuned. Low back pain and sciatica symptoms are absolutely terrible. This episode, we're going to go over 4 positions that's going to eliminate your lower back and sciatica symptoms. So, when we look at the lower back and we see exactly why are we getting sciatica symptoms, the reason why we're getting sciatica symptoms is because we got this thing right up in here. That is a disc herniation, and that is pushed on that nerve and causing the pain to shoot down your body, into your hips, and down your leg and into your feet. So let's go ahead and start about different positions that you can do to try and get yourself a good night's sleep. So position number 1 I'm going to show you here is you're actually going to lie on your back. You're going to bend your knees up. You want 2 to 3 pillows underneath your legs so you can unload that back and lower part of your spine, and give yourself about 20 to 30 seconds for all your muscles to relax before you go ahead and try the other positions. Now, the other most important thing here is in making sure that you're not crossing at your hips, at your knees, or your ankles. That way you're not getting a twisting motion occurring at the back. Now, position number 2, you want to make sure when you're lying on your stomach, you want the pillows underneath your belly button. You want at least 1 or 2, probably 2 would be more beneficial for you than 1. And the caveat is you want to take a thick rolled towel and put it at your ankles. People always forget this. This will help unload the nervous system that's irritating your back and down your legs. So that is a huge caveat that a lot of people don't look at. They talk about putting pillows underneath their belly, but they do not do that piece. You have to do that piece. The next position you want to put yourself in is you want to make sure when you're lying on your side, you put the pillows between your knees, which everybody knows about. But what they don't tell you is making sure that if you can, get yourself back against the wall of your bed and put a towel roll at your lower part of your back. What that will do is keep your back in a nice stabilized position. As your muscles relax throughout the night, you still have that stability in your spine from the towel roll. Now, you can do that towel roll even from the other vantage point that I'm showing here, where you take that towel roll and you wedge it underneath the bottom of your hip. That'll also help from rotating your spine throughout the night. Now, if you're lucky enough, you might have some sort of sleep number bed or some sort of Craftmatic bed that inflates and makes that bed firm. You want to make sure your bed is firm. Do not have a soft, cushy bed when you're having sciatica and low back pain. Your spine is craving for stability and firmness, and that's what you need to give it. So you might want to even take a flat board and have a family member come with you and literally just take a OSB flat board and put it in between your box spring and your mattress to make that mattress a little bit firmer so that you can actually get a good night's rest. So if you combine one of these various positions and then you also put on top of it that solid stability from either a board or if you're lucky enough to have the inflation of the bed, then you'll see a significant reduction in that nerve symptoms. Now, I'm going to leave a link up here, and what I want you to do is click on that. That's going to go over some various treatments that you might want to do to try and reduce that sciatica symptoms before you try and sleep at night, besides just loading yourself up with, gabapentin or Neurontin or some sort of opiate like Percocet or hydrocodone. Those are obviously you want to do those. But if you can also, on top of it, do these other positions, sleeping positions, and change the firmness of your bed, you're going to notice a significant improvement. Now, hopefully, if you like this episode, you'll give me a thumbs up. We'll get this out to other people to hopefully help them with their difficulty sleeping with sciatica and low back pain. And also, the one more important thing that you want to do when you're having sciatica or nerve symptoms is before you even get into bed at night, make sure you've done two things. Make sure you've given yourself time to not sit so much at night before you go to sleep. Get up and walk around for, I would say, 15 to 20 minutes. That way you're not in a static sitting position, which will cause the letter C that I call it in the spine and really put a lot of stress on that lower part of the spine. And ice it. Before you go to sleep, you want to reduce the inflammation in that area as well as the nerve symptoms. Icing it for 15 to 20 minutes at that lower back before you fall asleep will be a significant help to let you get a restful sleep. So, hopefully you've liked this episode. If you have any questions, leave me a DM down below. But until next time, Scully and I always like to say, look up and keep smiling. See you next time, folks.